Let me walk you through this comprehensive guide on cholecystitis, inflammation of the gallbladder. We'll explore the essential aspects of this common but serious condition, including its causes, key symptoms, and treatment options. Our presentation draws from an article by Dr. Rajarshi Mitra, a laparoscopic surgeon and proctologist practicing in Abu Dhabi, UAE, who will help us understand how doctors diagnose and manage this condition. One of the most telling signs of cholecystitis is sudden, sharp abdominal pain. When the gallbladder becomes inflamed, you'll feel intense pain in the upper right abdomen that often spreads to the right shoulder or back. This discomfort typically gets worse when you take deep breaths and becomes particularly noticeable after eating fatty meals. Let's understand what happens in cholecystitis. When the gallbladder becomes inflamed, the process starts when bile flow gets blocked, causing trapped bile to irritate and inflame the gallbladder wall, leading to swelling. There are three distinct types: acute cholecystitis from sudden gallstone blockages, chronic cholecystitis that develops from repeated attacks, and a calculous cholecystitis, which occurs without gallstones after major medical events. Here's a crucial fact. Gallstones are behind more than 90% of acute cholecystitis cases. These hardened deposits of cholesterol or bilirubin get stuck in the cystic duct, blocking bile flow and triggering inflammation. Other contributing factors include biliary sludge buildup, obstructive tumors in the bile ducts, and conditions like diabetes that can impair blood supply and increase infection risk. When it comes to gallstone risk factors, we can divide them into two categories. Some we can't change, like age, gender, family history, and ethnicity, with certain groups having higher risks. But others we can influence, maintaining a healthy weight, avoiding rapid weight loss, eating a balanced diet, and managing conditions like diabetes. Understanding these risk factors helps us make smarter choices about prevention and early intervention. While that sharp, persistent pain in the upper right abdomen often gets the most attention, it's just one piece of the symptom puzzle. Watch for other warning signs like jaundice, changes in stool and urine color, nausea after fatty meals, abdominal bloating, and fever with chills. Knowing these symptoms helps you stay on top of your health. Let's look at what happens when you visit your doctor with suspected gallbladder issues. The diagnostic process typically follows 3 steps. Your doctor starts with a physical examination, checking for abdominal tenderness and performing tests like Murphy's sign. Next comes blood work to check for infection markers and assess liver function. Finally, imaging tests provide clarity, usually beginning with ultrasound, which excels at detecting gallstones. Complex cases might require more detailed imaging like HIDA scans, CT, or MRI to fully evaluate gallbladder function and identify any blockages. When someone comes in with acute cholecystitis, our immediate focus is stabilizing their condition through hospital care. We concentrate on 3 key approaches: controlling severe pain with appropriate medications, giving IV fluids to prevent dehydration if they're vomiting, and using antibiotics to tackle gallbladder infections. This helps us get inflammation under control and stabilize the patient before moving on to definitive treatment. For patients with gallstone cholecystitis, cholecystectomy remains our go-to surgical solution. We prefer the laparoscopic method, using small incisions and camera-guided instruments for a faster recovery. In complex cases where inflammation is severe, we might need to switch to open cholecystectomy with a larger incision. For acute cases, we aim to perform surgery within 24 to 48 hours to prevent complications. Sometimes surgery isn't an option, and in these cases, we have 3 main alternatives to consider. Percutaneous cholecystostomy offers temporary relief through external drainage. Oral dissolution therapy is another option, though it works quite slowly. Finally, dietary changes, especially following a strict low-fat diet, can help manage symptoms and prevent future attacks. Each alternative provides a different path for patients who aren't surgical candidates. The importance of prompt treatment cannot be overstated. Untreated acute cholecystitis can lead to 3 life-threatening complications. Gangrene develops when decreased blood flow causes gallbladder tissue death. A gallbladder wall rupture spills infected contents, leading to peritonitis. And if a gallstone blocks the pancreatic duct, dangerous inflammation follows. These serious risks make immediate treatment vital. Here's some good news. Most people adapt very well to life without a gallbladder. After removal, your liver keeps producing bile, which flows directly into the small intestine. While you might notice some temporary digestive changes after eating fatty meals, these usually resolve as your body adjusts. Following a low-fat diet during those first few weeks helps ease the transition. You can take active steps to prevent gallstones. The key is maintaining a healthy weight through gradual, steady progress. Avoid rapid weight loss, as this can actually trigger gallstone formation. Focus on a balanced diet rich in fiber from fruits, vegetables, and whole grains, while keeping fat intake moderate. Regular exercise helps regulate bile flow, making it another crucial factor in prevention. Consistently following these lifestyle changes creates a strong foundation for gallbladder health. Many people ask about the difference between a gallbladder attack and cholecystitis. A gallbladder attack causes temporary pain when a gallstone blocks a duct, while cholecystitis is more serious. It's ongoing inflammation requiring immediate medical attention. Without treatment, cholecystitis can lead to severe complications like rupture and sepsis, though proper medical care typically leads to good recovery. After gallbladder surgery, following a healthy diet is essential. Avoid fatty, fried, and greasy foods while your body adapts to its new normal. Let's wrap up what we've learned about maintaining gallbladder health. While cholecystitis is serious, early treatment leads to excellent outcomes. Stay alert for sharp pain in your upper right abdomen. Most patients find safe, effective treatment through laparoscopic surgery. Remember that a healthy weight, proper diet, and regular exercise help prevent gallstones. Don't hesitate to seek medical care if concerning symptoms develop. A final important note about medical disclaimers. This information is educational only and isn't a substitute for professional medical advice. Always consult your physician about your specific situation. For medical emergencies, contact emergency services immediately. Remember, reviewing this information doesn't create a doctor-patient relationship.